Hello and welcome to this episode of Akrinos Access. I'm your host, Eric Matei, joined today by Colton Calandrella. Colton is the CEO and co-founder of Barti, a fascinating new EHR that's doing some outrageous things. And we got a really cool episode lined up here as Colton and I are going to embark on this journey, assessing the world of EHRs and optimizations for the modern practice. Colton, hello. Welcome to this episode of Akrinos Access.
Yeah, thanks for having me, Eric. Really excited. We're going to dive into a bunch of fun, exciting topics that I think are top of mind for a lot of people today. So,
absolutely. Arguably, though, none as top of mind as they are for you, right?
Yeah.
And maybe I think let's go ahead and kick off this conversation, kind of understand what you guys are out to do. Like, what got you into being a part of a tech startup building EHR for optometry?
Yeah. Well, in short, what gets me out of bed in the morning is helping eye doctors and optometry practices better run their business. What I found after doing a ton of research and talking to over 150 practice owners in the space is that most doctors spend up to half of their day just documenting. For a 30-minute patient visit, 15 minutes of that is just documenting. It's incredibly tedious, manual, and it's one of the biggest time sucks for a doctor. So my background, have built other startups and other software products, was working at a healthcare consulting company before, and really just connected with my co-founder, Dr. Kelly Kai, and we continued to hear over and over again how much pain there was from EHRs, which are kind of the poster child for hated software in the general technology world. EHRs are what people love to hate. And so our goal at Barti is to build the first one that people will really love. And so I'm passionate about helping owners really uncover the true potential of their business because there's so much hidden potential trapped due to their software tools.
Yeah, it really is a fascinating world. You know, we're talking about electronic health records. I mean, just healthcare is such an integral part of the day-to-day. It's such an integral part of the economy as well, right? And EHRs play a critical role in data management, data security, data integrity, patient care operations, and the list goes on. So, Colton, why don't we maybe start this conversation? Maybe you just provide a little bit of the lay of the land, kind of maybe talking trends in EHRs, and perhaps also maybe put it in context of the history of things, right? I mean, EHRs have been around for a number of years. A lot of things have evolved. So why don't you kind of start to set the stage and talk about kind of what's going on out there with EHRs and optimizations right now?
Sure. So, I think the background of EHRs are really the pain for all patients and doctors. So many things that people hate about healthcare stem from the bad software. So when you have to fax and call your 3 different doctor's offices to fax your records, that's because of the EHR. When doctor burnout, the number one factor of doctor burnout across healthcare is the documentation in the EHRs, because people who train for 8 years spend half of their day clicking and typing. For optometry, for example, it takes 100 clicks just to document one routine eye exam. So unfortunately, EHRs have a history of really hard to use software that actually ends up coming between the doctor and the patient. And they really started about 20 years ago with good intentions and good hopes. They became a lot more mainstream after the Affordable Care Act. And now most doctors have some form of EHR, but most of them were built 20 years ago. There's been very little innovation in this space, and that's particularly true in optometry. So Barti is the first new EHR in over a decade. All of the other EHRs in the space were built 15, 20, 25 years ago. I was talking to a practice who's been using theirs for 40 years. And so that's not necessarily a good thing when it comes to software. I don't see a lot of doctors walking around using Motorola Razors or Blackberries. And that's because when it comes to technology, you generally want what's the latest, because that means it's better. It's faster, sure. It's safer. And, so that's really what we saw with Barti as an opportunity, because unlike most other healthcare spaces, there's at least some innovation on the EHR side. There was really nothing in optometry. So In terms of trends that we're excited about, maybe I could talk about those. There's three things that Barti is really excited about and seeing both in optometry and across healthcare. And that's the rise of AI. We're seeing more and more tooling embedded in the EHR. And then we're also seeing a growing awareness of the importance of data, which I know is something that you at Akrinos are also really excited about.
Absolutely. And I tell you, I think on this, and before we kind of jump into each of these three, really eager to unpack each of these, Cole, but I do just kind of want to recap on what you were saying there is kind of this intro, right? And identifying that documentation is a leading driver of provider burnout. And I think, this is vital. This is so big, so important, y'all. We need to be sure that we're having systems in place and operations in place and protocols in place that empower and lift up our healthcare providers, not shackle them to a computer, right? But fascinating, you cited that. Something else I thought was really interesting is that you said, from the standpoint of eye care, optometry, it's roughly about 100 clicks just to get through a comprehensive eye exam and patient encounter. It's shocking. It really is outrageous. So let's then kind of shift gears now into you say in the context of this, this is kind of y'all's why, right? And
Yeah.
You guys kind of have these three big key areas that y'all are really excited about. By the way, I think you guys were hitting at some of this recently with some posts y'all were making. I know both Barti and Akrinos are going to be at Optometry's meeting here coming up in just a few weeks. And I know you guys have some exciting announcements coming out there. So maybe you can tease us a little bit with some of this stuff. So let's maybe start, Colton. Let's talk about AI and the applications of AI to electronic health records.
So, my hot take with AI is everyone loves to talk about it, but very few people are actually using it day to day for practical things. But I think that when it comes to documentation in the EHR, it's one of the single best practical use cases of AI anywhere in the world, because we're solving a hair on fire problem for doctors that is largely manual. And that's the charting, the typing, and the clicking. And so what we've now done at Barti and other EHRs and other spaces have done this as well, is incorporate an AI scribe. The technology has gotten so good that you can now have an encounter with the patient, have a normal conversation, and anything that's spoken out loud will get summarized, categorized, and then put into the chart for you as the provider. And then the provider can just review it and make any tweaks and finalize it. So that 100 clicks goes down to like 5 clicks for an entire exam. So we're just now rolling this out at Barti. We have it in parts of our exam, and we're excited in the next few months, you're going to be able to do the entire exam just through AI transcription at Barti. And this has been clinically shown in other healthcare settings through peer-reviewed studies to save 1 to 2 hours of doctor time per day, which is just insane. There is no other intervention that you can point to that saves that kind of doctor time. This is being rolled out at health systems like Kaiser Permanente, and most hospitals now have adopted this as one of the most quickly adopted technologies in healthcare history, because that's how powerful this AI scribe technology is.
That is, Colton, when we look at how massive the public health need for vision, medical, and specialty eye care is, and the growing need for care. And I know we've all seen the studies regarding, doctor shortages and pressure on the system and such. This is absolutely groundbreaking stuff, and a marvelous use of AI as well. I think it's also important, as you mentioned, AI. It's such a fun buzz term and concept and stuff. And yet, it's really a matter of finding these practical applications of it. And where there is something that is such as data entry, documentation within exams, it's a perfect use case for AI. Really fascinating stuff there, Colton. Okay, so other trends in EHRs, you said AI. Something else you mentioned is tooling. So why don't you just kind of expand on that concept for us?
So EHRs have always been the lifeblood of the business because they have the patient data and the health data. Now they've absorbed more and more of the tools, more of the practice operations all live within the EHR. which means things like payments, payment processing, text messages, online scheduling and intake forms, things that didn't used to live in the EHR. All of that is now more and more being added to existing systems, which is good from a provider standpoint because now you don't need a bunch of different tools. But it also means it's even more important that you have the right system, because if you have one system that does it all, but it's all kind of not very good, then you're also kind of painted into a corner. So that's been one fascinating thing. We've seen even more data, even more of the patient and provider journey go into the EHR. People are using it for more and more. It's become even more central to the business.
Yeah. Fascinating stuff. Fascinating. So we've got AI, that use case there as far as radically reducing that time, right? Secondly is tooling, where we're looking at, I mean, obviously anything that's going to improve efficiencies, and the fact that now these EHRs are getting into more tooling, more holistic operations is huge from an efficiency standpoint. But also, Colton, I think in that tooling standpoint is now we're getting to something where we find opportunities for the business to scale, right? Particularly when we're looking at all the different ways to connect with patients outside of the practice and ways to grow the business in that way. So let's jump into that third one. You said the third trend that you're really hip to is this awareness of the value of the data, right? So why don't you expand on that a little bit?
So, unfortunately, I talk to practice owners all day, every day. And unfortunately, I find that most of them are flying completely blind when it comes to their practices' finances and their KPIs. And what I mean by that is they couldn't answer basic questions like, how many patients did you see last week? What's your average revenue per patient? What was your no-show rate last month? Or even just directional answers to some of those questions. One of the big reasons for that, unfortunately, is a lot of the tooling in the EHRs and practice management have been really bad. And I know you at Akrinos are really passionate about good data. And so now, though, this is becoming more mainstream in optometry, which is good. This has been mainstream in other healthcare industries, other business industries for a long time, but it's becoming more mainstream in optometry. People are using more third-party tools to give better data analytics, working with experts like Akrinos to analyze their data. And, here at Barti, we're doing that as well on the foundational side. Because unfortunately, as you also know, Eric, it's garbage in, garbage out with anything related to data or analytics.
Sure.
Meaning, if the staff isn't collecting the data right, or if the EHR system is not set up properly, then you're going to get bad data. And our understanding from other consulting firms we work with in space and others is almost no other optometry EHR actually has the proper accounting ledger and some of the actual foundational data models to accurately depict your business's finances. And for example, to make all of the correct accounting systems tie. So usually there's a ton of back end work that accountants are doing to kind of, make the numbers connect. But that's something that we're excited about at Barti, that more and more people are becoming more aware of that importance.
Yeah, that is really fascinating. Tremendous good point there regarding quality of the data, right? Because for instance, like with what you're bringing up there, Colton, really kind of, I guess, ties back to the fact that so many doctors are out there perhaps doing their own accounting, right? Either not working with a CPA or never providing that CPA with the tools they truly need to be able to serve that optometry practice to the best of the ability. And it all ties back to that chart of accounts, right? So really fascinating to look at these ways that how you can dig into the data and utilize that data for the strategic decision making. So Colton, let's kind of expand on this again. These three really exciting trends going on right now in EHRs. That being the role and use case of AI, opportunity for further tooling, and having the EHR as kind of like that mainframe for practice operations. And then the third piece is data powered insights into the business, right? Which, as you know, Colton, I mean, huge part of what we do at Akrinos. It's in our name: analyze, strategize, implement, right? But now let's jump into maybe talking about just some of these, how these impact different aspects of the practice. Strategic decision making across the patient journey. Performing operations. Practice economics. How are you seeing these trends are going to impact some of those key elements of running the business?
Yeah. Yeah, absolutely. Maybe starting at the highest level as a segue to the data conversation is strategic decision making, you said. And again, it sounds obvious, but making strategic decisions about your practice without good data is like steering a ship in the fog at night. Your odds of making the right decision are slim to none. Slim to none. It's just almost impossible. So you have to have the right map. You have to know the right data to understand even where you want to go. And that means, again, just having awareness into basic profitability, knowing what your cost centers are, knowing what your trends are over time, and what the levers are you can pull in your business to improve revenue or decrease cost. And so, again, the EHR without that, or without a third-party data tool, or without a consultant that can put all that together and really unlock the insight for you, you're going to be flying blind. In terms of the patient journey, this is something I'm really passionate about. Obviously, all of us are also patients in this industry. And again, it's something that's I find lacking at a lot of practices. Unfortunately, the patient journey is more like the patient journey from like 20 years ago at other healthcare settings. So, that includes big things like a lot of practices still don't have text message reminders to do automatic reminders for appointments or recall. They're sending just postcards, which, nothing wrong with postcards, but a lot of people prefer having text messages. And there's many studies that show that. In terms of the patient journey, this is a small thing that Barti's helped. Again, consolidating different tools is we helped a practice who had 3 different phone numbers texting their patients. They had one number for appointment reminders. They had a different number for something else. And so Barti helped them consolidate to one number so people don't think they're getting spammed from different text messages. And that seems minor, but actually, for a lot of patients, it makes a big difference.
Absolutely.
Yeah. And then, finally on the practice workflows, again, that's where the AI scribe comes in handy, saving 1 to 2 hours of doctor time. In the future, Barti has some really exciting plans for a full AI agent. So imagine almost like Jarvis from the Avengers, or like if Siri was actually helpful, being able to take so much manual work off of you and your staff's plate. That's a big thing in the future. AI, we're just really getting started with. So.
Outstanding stuff. I mean, Colton, this is absolutely outstanding. And I realize in each of those little areas, I mean, we're kind of touched on some of this stuff at a pretty high level, but I know, thinking of some of the conversations you and I have had offline, it's really fascinating to consider in each of these specific areas, just how much potential is there. So why don't we, as we're kind of starting to make our way around to the home stretch, Colton, I'd like you to maybe comment a little bit about, where can doctors start with really enhancing and optimizing that EHR? I mean, it's one thing if we're talking about a brand new practice, cold starter practice. Hey, it's easy, right? But let's really think about that practice that's really humming along, making it happen. I mean, because arguably these are the practices that are going to stand to most benefit from the optimizations, right?
Yep.
So where can they start, right? They're already busy. So where do they start really digging into optimizing the EHRs, perhaps making changes to the EHRs?
So the first place to start is a quick, I call it an audit of your tech stack. It just is a list. Make a list of every software you use in the business. And you might think, oh, it's just one. But then when you actually write it down, you might discover you have 2, 3, 4, 5 different softwares. One for texting, one for email messaging, one for your EHR, maybe another one for inventory, another one for analytics. So just write that list down, write down the monthly cost. And if you're using more than 2 tools on a daily basis, you should think about looking for a more consolidated platform. That's the quick heuristic.
Gotcha.
The other test is going back to my questions. If you can't answer some basic questions quickly, like how many patients did you have last week, average revenue per patient, your capture conversion rate, if you can't answer those quickly, you should also consider evaluating your systems or looking more deeply. Even if you're happy and everything's going great, just like any other major part of your practice, it's still a good thing to look for when new things come out, when new technologies come out, just to evaluate and see if they can be helpful. So we always encourage people to take some time to come chat with us. We can do an analysis to how much money we can save you by switching over other softwares. And at Barti, we only take 1 to 2 hours to get people up and running. We're 10 times easier to use. So when it comes to switching EHRs, it doesn't need to be weeks or months. It can be like hours or days with Barti.
It's that easy.
It's that easy. Just call them out. There's a number on your screen for $19.99. You can get, yeah.
Well, and I know, and I can speak firsthand to the quality and innovative products that is Barti, right? I know we've got some Akrinos clients that are also users of the Barti platform, and outstanding stuff. So as we kind of pull it around to the home stretch, Colton, why don't you share how folks can get in touch with you guys and learn more, maybe snag a demo and such?
Yeah, Barti.com has a ton of information, some press releases, and customer testimonials, so you can see what other doctors are saying about Barti, and easy to schedule a time that's convenient for you with one of our product specialists. If you want to reach out to me directly, it's Colton@Barti.com, and we would really love to chat with folks again, even if you have a system that's working. We've helped a lot of people dramatically improve even a system they thought was okay. So yeah, give us a reach out.
Cole, I tell you what, really fascinating world right now in eye care, this world of EHRs and tech, and I mean all this cool stuff you unleash there, right? This world of AI, it's a tooling you guys are getting into, utilizing the data. Really, really fascinating to see this stuff evolve. Also, Colton, in that it's been about a year now that we've had that first Akrinos clients working in Barti, so we are seeing firsthand the results and impact that it's having on operations and having in practices. So, Colton, you guys continue to do amazing things over at Barti, and why don't you also share? I know you guys are very involved in the profession. You guys are going to be exhibiting at optometry's meeting, I believe, giving some continuing education at optometry's meeting.
Yes.
So why don't you share a little bit about some of the things that Barti is also getting involved in supporting the profession?
Yeah, we're huge proponents of the AOA and your local state associations as well. We go to as many state meetings as we can, and we've had a booth at optometry's meeting ever since we were founded. We're really excited to be running a big CE at optometry's meeting for para-optometric professionals about how to use an EHR from soup to nuts. And so we're going to have dozens of folks there. We're going to have myself, my co-founder, Dr. Kelly Kai, and other Barti team members. So check us out if you're going to be at optometry's meeting, and definitely consider going if you're not already scheduled.
Absolutely. Yeah. Well, Colton, man, thank you so much for joining us here on Akrinos Access. To all of our viewers out there, we hope you found this a valuable exploration of EHRs and optimizations for the modern practice with our guest, Colton Calandrella, the CEO of Barti.com. If you want to learn more about this world of EHRs and optimizations, and specifically some of the cool things that Barti is up to, head on over to Barti.com. If you want to continue the conversation with Colton, you can connect with him via email, Colton@Barti.com. And look, for more great practice management tips, insights, and solutions like this, be sure to follow Akrinos across the socials, subscribe to the Akrinos YouTube channel, and head on over to Akrinos.com when you are ready to get started, starting, growing, transitioning that modern practice. Colton, thanks again for joining us on Akrinos Access.
Thanks a lot for having me, Art. See ya.